Good morning, good afternoon, good evening. Welcome to our USAID Office of HIV/AIDS third annual local partner meeting. I am Callie Rolfs-Wong from the USAID Office of HIV/AIDS in Washington. My team has been working with ASAP behind the scenes to help put together this meeting for you, which I hope you will enjoy. This is our first day of our joint local partner USAID meeting, and I am so pleased to welcome here today over 1,100 participants that have registered for this event. Approximately half of those from our local partner organizations, half from USAID staff, with over 40 countries represented. Last year, we had close to 600 participants at this event, so we have almost doubled the total number of registrants. I think that really speaks to the importance of USAID PEPFAR's work with local organizations and the importance of this meeting to really bring folks together to share best practices and build relationships. We have three objectives with our third annual local partner meeting. Our first objective of this meeting is to ensure technical and operational excellence in COP21. We have a number of panel sessions, local partner panel sessions, as well as technical guidance sessions, really built around making sure that the best practices in programming are shared and that our local partners have access to the latest guidance from our OHA teams here in Washington. Our second objective of this meeting is also to develop stronger relationships between USAID and local partners. We know relationships are so essential to any successful partnership. Later today, we will have a number of listening sessions for many countries and local partners. This will be an opportunity for local partners to share with USAID feedback on how we can work better together. Lastly, our third objective is to strengthen communities of practice between local organizations. We really wanted to make the time and space for local organizations to learn from each other and share lessons learned with each other. Day 5 is a local organization only day. No USAID staff will be present at that day. That'll be an opportunity for local organizations that are funded by USAID to really develop communities of practice and strengthen those learnings between each other. Just a few quick housekeeping items before I turn it over to our first speakers. We have live simultaneous translation for this event. For the plenary sessions, such as this session, you can find that translation actually on the platform. So you would select on the platform either English, French, or Portuguese. You can hear the meeting translated live. For all of our non-plenary sessions, when you go into the Zoom room, you will be able to click on at the bottom of the panel of the Zoom, there's a globe icon. You can click that globe icon. It says interpretation, and you can hear live interpretation in French and Portuguese in the Zoom rooms. That's applicable for our local partner technical panels and our technical guidance sessions. For the listening sessions today, which I'll talk a little bit more about before we go to those, we will also have Spanish interpretation. Okay, I think that covers my opening housekeeping remarks. I am very pleased to turn it over now to our Acting Assistant Administrator for Global Health, Jennifer Adams, to make some welcoming remarks. Jennifer, over to you.
Thank you, Callie. Thank you, and welcome to everyone, to all of you for joining the Office of HIV/AIDS local partner meeting. I really want to appreciate the Office of HIV/AIDS for organizing this event. It's quite an event and quite a task, and I want to thank everyone who participated in organizing it, and especially Clint Kavanaugh for leading that effort. I also want to thank all our USAID colleagues who are joining from Washington and from missions all around the world, and especially welcome to the over 150 local partners and government partners who are joining us here today to share your successes and your learnings. I just want to make a couple of introductory remarks, and one of them I think that's important, of course, is about COVID. So we know that all of you in the field and here in Washington have been dealing with the impact of COVID-19 for more than a year and a half. And that's both an impact on your work, also an impact on your personal lives, and it continues to affect us in almost everything we do. So we know that our partners have faced complex issues in their work that affected how they implement their health programs, and also have changed some of the ways in which we can deal and advance the mission with beneficiaries, the services, and their care. So I want to appreciate that in these very challenging times, so many partners were resilient and adaptive and went above and beyond and really worked so hard to make sure that the health programs and the services were there to meet the client needs. So I want to appreciate all of that effort under some quite strenuous and prolonged strenuous time. And I think it's that kind of innovative thinking and that kind of creativity that will help us, all of us, to reach and maintain HIV epidemic control. And I think over the next few days, we will hear some very, very interesting presentations from local partners about how these PEPFAR solutions can also be adapted to accommodate and address some of the other global health needs that now present. Another comment I want to make is about the way that many of you have been able to adapt during the COVID-19 response to also support health programming beyond HIV in areas that were so negatively affected by COVID as well. So maternal and child health, TB, malaria, and adapting the programs to be able to work with multiple donors and multiple streams of funds and still achieve the mission. So this morning, this plenary panel will highlight how many of our local partners are working in the HIV space and beyond the HIV space, excelling in addressing COVID-19, also human rights, and responding to natural disasters. Until very recently, I was the mission director in Mozambique, and I just want to highlight that I know from my experience in the field how important localization is and how much it takes to achieve it. So I'm really heartened that we have so many local partners. I hope we have some Mozambicans there. If we do, bom dia e parabéns para todo o trabalho conosco e a cooperação. So hopefully in the coming days, you all will be getting to hear your own stories, exchanging from different parts of the world and different types of experiences. And I think all of us are excited to share in that. I also want to make sure that everyone realizes that USAID as a whole, both the Global Health Bureau and the agency as a whole, is really committed to localization and local development. Really, the global health programming is in the lead on that and has been a model for how we can change and affect how the agency does business. And that's really the work of so many of you that are here today. We have over 500 staff from over 150 local organizations who are attending the meeting, and all of those partners represent close to 80% of the agency's direct funding to local partners. So you can see that you are really in a leadership role, and there are many, many other organizations that are looking forward to learning from you and recognizing the importance of the USAID PEPFAR program and the Global Health Bureau in fostering local partnerships. You'll be able to hear from some of the leadership in the agency in USAID this week in interactive sessions where they will be able to explain to you the importance of pushing an agenda to achieve local ownership and priorities, and be able to hear from you and get some feedback on how we can improve in USAID in these partnerships and how local organizations can help us to achieve health objectives and broader development objectives. So I hope that during this time you will be candid, you will be specific. Please let us know how we can do better and how you see the future development of the localization program and what can we do to support you. We do talk to you a lot, sometimes at you a lot. So take the opportunity this week to talk a little bit at us. And USAID staff, thank you for your willingness and taking the time to listen and to respond to the points and the issues raised by our local partners. So just to say thank you again in closing, we really appreciate that you're here. We're looking forward to this week and to the learning that we can share and the experiences that we can hear from each other to continue to bring the HIV epidemic under control and really further localization and make it a reality for our programs across the globe. So thank you for your time and see you this week. Over to you, Callie.
Thank you so much, Jennifer. And thank you also, Jennifer, for your leadership around the localization efforts in OHA. We are always so grateful for your support. And next, it is my tremendous pleasure to introduce our acting global AIDS coordinator from the State Department for our PEPFAR programs, who has also been a tremendous champion for working more closely with local organizations. We have with us today Dr. Anjali Atrakar. Over to you, Anjali.
Terrific. Thank you so much. It's wonderful to be here with all of you. Good morning, good afternoon, good evening. First, let me start off with echoing Jennifer's thanks. What an extraordinary difficult time it's been over these past many months. But I really want to thank USAID and particularly the leadership of Clint Kavanaugh and all at USAID OHA for your leadership, all of you in country, implementing partners, and particularly the local partners that are here with us today. The work you've been doing with your whole heart, through very difficult times is phenomenal. It's awe-inspiring. And I just really can't thank you enough for the life-saving work that you've been doing. Some years ago with PEPFAR, we set out together and established this big, bold goal. Can we really move the dial on advancing service delivery to local partners and making sure that as we work together, we can sustain the efforts. And I just am really proud to be here today to talk about the progress we've made collectively and the essential role that local partners play in that, because you've made tremendous progress. USAID has made tremendous progress. The local partners have made tremendous progress. And I'm here to show you how you've contributed to this overall. So on the next slide, just to say at the outset that, as many of you know, PEPFAR for the past 18 years has really experienced tremendous bipartisan support from every administration that has come in across Congress. And a real large part of that support is because of the impact that the program has been having. Over the past 18 years, we've continued to work to really serve the people and the communities in which we work. And again, you are a large part of that effort. On the next slide, I'll walk you through briefly just a high-level summary of the program status, particularly through COVID-19 across all of the PEPFAR programs in 55 countries all around the globe. But just to give you a snapshot of where we're at, essentially, ever since February of 2020, we all have been adapting the program in real time to really impact COVID-19, help preserve the gains in HIV, and also to use the health system platform to help accelerate the work we've been doing with HIV and also respond to COVID-19. Over time, What we've seen is essentially because of your extraordinary efforts, HIV treatment has been preserved and increased. We've seen some dips in general testing and prevention services like circumcision and dreams prevention, but those services have since recovered and are on track and increasing. We've also seen some services scale rapidly, like self-testing and pre-exposure prophylaxis, multi-month dispensing, and decentralized drug delivery, and we'll talk a little bit more about that. And as I noted earlier, PEPFAR-supported health systems have been leveraged to really strategically respond to HIV and COVID-19. On the next slide. So all in all, when we look at the high top-level results of where we're at, and this is the latest, 18.4 million people are on life-saving treatment. This is a 1 million increase in the last 6 months alone. So again, really incredible work together. We have made progress simultaneously with circumcision. Like I said, there was a dip, but we continued to increase. We continue to serve orphans, vulnerable children, and their caregivers. And we continue, even with the dip, to increase again with prevention services for adolescent girls and young women in our DREAMS programming. On the next slide. This gives you a sense of, in the red line, those that are on treatment in the PEPFAR program. As you can see, we've maintained HIV treatment continuity and growth despite the peaks in COVID-19 transmission that you can see in the color along the bottom there. Next slide. And this is just a little closer look at some of the work we're doing together on prevention services in the DREAMS geographic areas serving adolescent girls and young women. So you can see in Q2, a drop in services for prevention, but then a stark increase again. And this is because of adaptation of the program that you all have been doing, serving women in a virtual manner to keep them safe, for example. And then on the right, we see the scale up in PrEP, which again, really speaks to what clients need and want. Next slide. Again, for many, many months, you all have been at the forefront of adapting the program and leveraging the program appropriately so that we can respond to both HIV as well as help on COVID-19. On the next slide. And here, I think what's really important to note is that the PEPFAR platform really serves as a care delivery platform for HIV and, as we've seen, for COVID-19. The US government teams in country, and especially the local implementing partners, you have been essential to the work that has been happening, particularly during COVID-19. The laboratories that you've been working in or serving, the healthcare providers that we've been supporting, whether they're nurses, doctors, community health workers, the commodities, supply chain systems, you know, these have been essential also in responding to both HIV as well as COVID-19. You all have been doing everything from COVID-19 screening, diagnostics, to now actually getting vaccines into arms. This has been tremendous. Next slide. This just gives you a sense of how quickly multi-month dispensing has for ARVs for stable clients has moved out. You can see a quarter one on the left of fiscal year 20, and then Q3 on the right of fiscal year 21. You can see much more gray and blue. This is extraordinary work, really pushing in a matter of months the number of people and the countries that are pushing out multi-month dispensing. Next slide. And final slide. This is a busy slide, but this really shows that over time, OHA, USAID, and all the other agencies have really been moving forward with prioritizing local partners, ensuring that local partners are at the forefront of where we're headed as we continue to work with countries to gain epidemic control of HIV and sustain that control. You are critical to service delivery of HIV services, you and the communities. And I really, again, just want to commend USAID for the really strong and steady progress you've made over the years, continuing to build the capacity of local partners and make that progress that's essential as we get to sustaining epidemic control. So thank you all for being here today. Thank you all for everything that you do. And back over to you, Callie.
Thank you so much, Anjali. It's really a pleasure to have you with us today. Next, I get the privilege of introducing our office director for the Office of HIV/AIDS, who has been a longtime champion of USAID's work with local organizations. Welcome, Clint Kavanaugh. Over to you, Clint.
Thanks, Kelly, and good morning, good afternoon, good evening, everyone. Before again, I also want to extend thanks to Dr. Ashrakar, who has been such an incredible supporter of our agency's work in an investment in local partnerships. Anjali has been supportive of ensuring that we have, as an agency, the resources we need in PEPFAR to really set you all up for success. And that includes increased staffing levels in the fields to support programming around local institutions. She has supported resources centrally and bilaterally to support capacity building work, and really has been singing your praises when she speaks to Congress and other key audiences like us. And you'll see in my presentation, you have been critical partners, but I just want to acknowledge that one of your greatest champions has been Dr. Ashrakar. So Anjali, thank you so much for your support. I also really want to acknowledge Kelly Rolfswong. Those of you who have worked with her know how lucky I am to have her in OHA. She heads up our capacity building and partnerships branch in OHA. Her team is phenomenal. And really our success in this space in large part has been driven through her leadership. Many of you don't know, but behind the scenes, she and her team have worked to identify what are the systematic roadblocks we have as an agency to really move at a fast clip toward investment in local partnerships, and has worked at the agency level to unblock those roadblocks. She has ensured that you have the assets that you need to be set up for success. So just want to acknowledge the tremendous leadership we have in this space through Kelly and her team. I'm incredibly lucky to be working with them. So again, thank you all for your work. And as others have said, thank you for all you've done during the COVID response. Your work has been tremendous. The commitment and investment of your team to continue to advance PEPFAR programming despite the pressures of the pandemic have been tremendous. And we'll see you've been able to continue to really move programming so successfully across the entirety of the work that we do in PEPFAR. Next slide. And next slide. I want to acknowledge that our new administrator, or fairly new administrator, Samantha Power, also recognizes the importance of local partnerships. She included this priority in her remarks, her opening remarks to the Senate Foreign Relations Committee in July of this year. We're lucky to have Samantha joining our meeting tomorrow to participate in a Q&A with you all. But she recognizes that investment in local partnerships are vital to our long-term success as it relates to sustainable development. And it's particularly important as it relates to sustaining the investment in the global HIV response. Next slide. I also want to acknowledge that Anjali and team are completing their next iteration strategy for PEPFAR. And it's clear that local investments are going to be a cornerstone of the sustained response in PEPFAR. We want to ensure that the investment that's been made over the last 18 and 19 years is sustained. And we continue to have people-centered HIV prevention and treatment services that are delivered through local solutions. We want to build enduring capabilities and ensure that health systems are resilient to the types of shocks that we've seen with the COVID pandemic, and that really we have the systems at both the central and community levels that are well positioned to be supported by local partnerships to really create enduring systems that maintain our success in PEPFAR. And lastly, we want to broaden the base of support to ensure that partners are sharing the burden and that the partner mix is really driven by local partnerships. Next slide. I want to note that this isn't a new priority for PEPFAR. The investment and prioritization of local partnerships has been inherent in the initiative since the very beginning. Going back to the launch and the Track 1 partners who placed a priority on transitioning to local partnerships. In 2008, the launch of the New Partners Initiative that focused on direct programming and funding to local partnerships. In 2013, the start of the Interagency PEPFAR Local Capacity Initiative. In 2015, the inclusion of local stakeholders, including CSOs and partners within the COP development process. And again, in 2018, the launch of this work really to guide our work of the last 3 years to get to 70% of funding to local partnerships. We began as an agency in 2019 with these meetings. This is our third meeting. The first was held in Johannesburg, and really see it as an opportunity not just to come together and talk about where we're going collectively as a team, but also to share best practices, both as partners and amongst mission leadership. So it's really been a long-standing priority for our work in PEPFAR, and obviously as we move into sustained epidemic control, will be even more of a priority for us. Next slide. I also want to note that as an agency, we're also looking at how we can position our agency assets to inform the sustained response. We've developed what we're calling the USAID's HIV optimization plan that really looks at, again, how we can not just leverage our assets within the HIV space, but really broader global health and the agency writ large to drive and support a comprehensive HIV strategy, and particularly to inform the sustained epidemic control era. We conducted over 90 interviews with the field, including ambassadors, mission leadership, health colleagues, other agency leadership, and we distilled all of these interviews and feedback, as well as technical inputs from our technical teams, into 5 critical pathways that we think are essential to supporting the sustained response. The first is around simplified service delivery models for multi-disease responses. As Anjali noted, one of the elements of that is multi-month dispensing. With the 18+ million people on treatment that we support in PEPFAR, the majority can simply now get 6 months of drugs and an annual viral load. We have then a smaller cohort, between 5 and 15%, that require more intensified services to get them to and to maintain viral suppression. And that package of services will require a bit more resources, but the efficiencies achieved by streamlining services for the majority of the clients on treatment will allow us to then reposition resources to again support those clients who may need additional support. Also recognizing the vulnerabilities we're seeing that are emerging in the youth bulge, and particularly among adolescents. So seeing the need to tailor packages of services that include health interventions, but also education, economics, resilience and support measures to really set adolescents up for success. And so really developing a robust package of services for adolescents and youth. Next, seeing the need to, as we're moving into sustained epidemic control, to develop really strategic packages of support for supporting host country governments with health sector financing, as well as leveraging private sector solutions. Next, as an agency that is leading on supply chains and logistic solutions, looking at how we can leverage these systems to be tailored to meet the needs of clients. And we've seen that again through the procurement and dispensing of multiple months of drugs, but also decentralized drugs distributions that bring drugs closer to the clients through community services, but also in many cases, home-based services. And then lastly, how we leverage the investment, the agency's investment in PEPFAR to date to support medium and longer term pandemic readiness and response. Across all 5 pathways, local partnerships will be critical, and we'll talk about that a bit further. Next slide. So I also just want to set the context of our global HIV results and adaptations that Anjali spoke to, that sets really the context of where we see local partnerships as being critical. Next slide. Again, many of you know, and you've seen the UNAIDS data that shows a number of countries already at epidemic control and many countries that are nearing epidemic control. That's going to require us as a collective community to start to look at programmatic and model pivots that will inform the next era of the response. Next slide. We've also seen a number of examples of where adaptations in terms of the COVID response have been critical, not just in terms of mitigating the pandemic, but will really be cornerstone interventions of, again, sustained epidemic control. I'm incredibly proud of the fact that we have nearly 99% of all quantities of ARVs in Q3 of this year being TLD, a regimen that really does not have the adverse events of previous regimens, and again, allows us to simplify services through MMD and an annual viral load. We delivered over 7 million bottles of TLD 90 and 180 count bottles to 20 countries as of Q3 of this year. As a global cohort on treatment, over 3/4 of our USAID treatment patients are getting at least 3 months of drugs. And we have a number of countries like Nigeria that are, and DRC that are close to 100% of the cohort on treatment getting at least 3 months of drugs. Again, this has been critical, not just in terms of COVID and reducing the number of engagements to health facilities by our clients, but also is facilitating adherence. And in terms of averting trips to facilities, the MMD scale up has been critical. In Q3 of this year alone, MMD helped to avert nearly 15 million trips by clients to facilities. 15 million trips. That is 15 million bus fares that didn't have to be paid, hours waiting in a clinic, clients who were at risk for acquiring COVID and other infections by engaging in health services. Since the MMD scale up has begun, we have averted nearly 60 million trips to facilities by partners. So this by clients. So this has been critical. In terms of local partners, again, you can see that as we began this work in 2018, roughly 31% of our funding went to local institutions. Again, we are at nearly 57% of funding to local institutions, and we've added a number of partners since 2018, going from 79 direct partnerships to 150 today. So incredible growth in breadth and scope of the partners that are now receiving direct funding from USAID. We've also, despite COVID, not only been able to maintain clients on treatment, but also add new clients on treatment. And local partners have been critical to that. We've added over 900,000 clients on treatment since January of 2020, which has been incredible. Again, not just to maintain clients on treatment, but to identify and add new clients on treatment. Next slide. We've also been able to scale up treatment and support to our most vulnerable populations. As of Q2, within our key populations portfolio, over 200,000 key populations are on treatment, exceeding our FY21 targets by 51%. Within the OVC space, USAID has expanded access to care for children affected by HIV by 247% since FY18. As of Q2 of this year, over 375,000 children affected by HIV are on treatment. That is 100% coverage for children who have been identified positive, which is a huge achievement. Within our dream space, as Anjali said, we've seen tremendous growth. USAID's leadership supports 1.3 million adolescents and young women with comprehensive package of services, representing 81% of the PEPFAR result. And then within prevention, again, have seen impact of COVID, but then tremendous growth in the dispensing of PrEP over the last 2 quarters. Innovations in PrEP delivery, including digital engagement with clients, decentralized services, have led to a 434% increase in beneficiaries receiving PrEP, from 84,000 in FY19 to over 450,000 as of Q3 of this year. Next slide. Within the OVC space, as I've said, there's been a tremendous achievement. And really, again, the adaptations have continued from virtual training to remote case management. But as you can see, over 95% of OVC under the age of 18 know their status. And of those who know their status and are positive, 100% are on treatment. Huge achievement. Next slide. Again, within the multi-month dispensing space, nearly or over 77% of our clients on treatment are getting 3 months, but even more exciting is to see the number of clients getting 6 months or more of treatment. So 27% of the cohort now getting at least 6 months of drugs. Again, over the next year or so, we'd really like to see that hydraulic shift between 3 and 6 month dispensing and see a greater percentage of clients getting 6 months of drugs. So again, we can facilitate their adherence on treatment, mitigate their need to engage services, and again, be able to apply these efficiencies to addressing the needs of clients having challenges getting to suppression. Next slide. I also want to acknowledge the tremendous work that has been achieved through supply chain adaptations. Here are a few examples from different regions in Africa. In Nigeria, the team used analytic and logistics data to really pre-order and anticipate the impact of the COVID on the programming that led now to, as of Q2 of this year, 97% of patients on treatment in Nigeria getting 6 months of antiretrovirals. Huge achievement. In South Africa, the USAID supply chain partners working with the National Department of Health rolled out 12-month dispensing. It decanted over 1.3 million patients to get ARVs through external pickup points, mitigating infection exposure challenges. In Mozambique, with the conflict in the north of that country, looking at supplying neighboring regions with multi-months of drugs to ensure that clients had access to these drugs despite the ongoing challenges, again, in the northern region of that country. Next slide. We've also been working at a headquarters level and at an agency level to ensure that we are leveraging our investments around COVID. We have adjusted our central mechanisms to be able to receive PEPFAR and non-PEPFAR related funds, to allow missions to make use of these central mechanisms to rapidly implement services where they're needed. We have been using PEPFAR partners, including you, to support contract tracing, risk mitigation, laboratory support, and other interventions, and including now vaccine readiness and deployment of vaccines. And really, you'll hear from Jeremy Conondike later today, how we are looking to leverage our strategic partnerships in PEPFAR to support the broader vaccine readiness and deployment program. Next slide. I won't go into all of this, but you can see really the comprehensive role that partners have been playing, our PEPFAR partners have been playing in the COVID response. And that includes from lab services to communications, to service delivery, to oxygen solutions. You, our partners, have been playing a critical role. Next slide. Next slide. So again, just to show, since COP17, where we began this work, we were at 31% of funding to local partners. We're currently in COP21, and as you can see, we've already grown to 57%. And based on projections, we anticipate being at 65% this time next year and at 67% the following year. Again, this has really been a tremendous lift by our field teams and really reflects the importance of the investment in local partnerships that our global teams recognize. You can see again that this represents over 200 million funding shifts since COP17. So really tremendous growth in this space. Next slide. I also want to show the role that our local partners are playing in our key indicators in PEPFAR. So in black, the denominator represents our global achievements as an agency in key indicators in PEPFAR. But you can see within the clients currently on treatment, local partners support 58% of that cohort. Supporting the multi-month scale-up of treatment, our local partners have supported 40% of the dispensing of drugs. For the identification and initiation of new clients on treatment, local partners are playing more than half of the role in that space, 52% of programming supported by local partners. In terms of case finding, identifying new positives, 48%. In terms of people started on TB preventative therapy, 45%. So you can see that our local partners are playing significant roles across the clinical cascade. Next slide. As it relates to our Orphans and Vulnerable Children programming, you can see since FY18 the increasing prominence of local partnerships, now with 41%, supporting 41% of the portfolio. Next slide. In terms of the scale up of PrEP, you can see that local partners are supporting 53% of that programming globally. And as Anjali has said, really supporting the uptick in services that we've seen over the last couple of years. I will note the sort of downward trend that you see in the upward section of that graph is not due to a dip in programming, but to a shift in programming frequency when we shifted to quarterly reporting. But again, huge achievement of local partners in driving our PrEP agenda. Next slide. Around prevention services for key populations, again, you're seeing this increasing prominence of the role local partners are playing. As of Q2 of this year, local partners are supporting 37% of programming in services related to key POPs prevention services. Next slide. Circumcision. Many of you know that circumcision globally was paused under COVID, but you can see as we start to grow services again, the role that local partners are also playing within this program area. Next slide. So as you can see now, as it relates to the COVID response, $136 million in COVID-19 funding for USAID was obligated to local partners across 18 countries. Although not as significant as an agency level, it's clear that the agency is recognizing the importance of local partners and who will play a continued role in this space. And Jeremy will be talking about that later today. Partners receiving USAID COVID-19 funding are PEPFAR, our USAID PEPFAR partners. And so it's really exciting to see how the investment within the PEPFAR space is being leveraged to support the COVID-19 response. I also want to note the critical role our PEPFAR partners are playing in Southern Africa related to the oxygen ecosystem, ICU infrastructure, and helping to, again, on the deployment of vaccines. Next slide. Throughout the health system, local partners are playing a key role. As we've said, we now have 150 local partnerships receiving direct supporting from USAID who are supporting services across the cascade. You can see in the previous slides how the prominence of local partnerships in that space. We're also seeing an increasing priority on using local logistics and supply chain providers to support tailored solutions at the local level. We're seeing a greater use of local partnerships as it relates to supporting healthcare workers. USAID globally supports 100,000 healthcare workers in PEPFAR, and many of those workers are supported through local partnerships. And lastly, you're seeing support at health facilities to support the full gamut of services in PEPFAR that local partners are playing. Next slide. Next slide. I also want to note that since we began these meetings over the last 3 years, we've heard from you, and we've been working over the last 3 years to also respond to what we've heard in terms of more tailored support to meet your needs. Next slide. We've also been reaching out to our mission leadership, including our AORs at the health office level, to hear what they need to better support their oversight of this work. We've triangulated the input and been able to see that where we have consistent themes, the need to address and support further programming, capacity building, compliance, technical support that hopefully will continue to set you up for success. Next slide. And some examples of this include around capacity building. USAID PEPFAR missions have supported increased training for local prime partnerships around USAID compliance, PEPFAR reporting, and financial management. Our central award mechanism, ASOP, has supported 57 webinars on a variety of topics related to organizational capacity and compliance for AORs for local awards. We've hired more staff to provide support and oversight of these awards. We've also been working to ensure that we're meeting the varied language needs of our local organization, making sure that materials are available in multiple languages. An example now is we're working with our financial office to clarify agency policies on cash advances. We've heard from you that that's an issue. We're looking at access to leadership. We as an office hold monthly calls with our IPs that include local partners so that you have information as we get it, and we can be providing you with technical updates that hopefully will drive programming for you on the ground. We've facilitated access to agency leadership, provided mission listening sessions, and you'll have access with our administrator tomorrow. Next slide. So in conclusion, I just want to again reiterate that moving forward, USAID will continue to increase direct partnerships with local partners. As you can see, we still want to move on this clip to increase investment in local partners, to invest in strengthening local organizations so that you are set up for success, not just in PEPFAR, to really be positioned to support broader global health priorities. We also see you as essential to sustained epidemic control. And again, as we move into this sustained epidemic control era, you, our local partners, will continue to play a critical role, not just in PEPFAR, but also in, again, the COVID-19 response, but broader global health programming. We want to ensure that our direct partnerships result in stronger local health systems that will endure beyond PEPFAR and USAID. So we'll continue to work with you, to hear from you what you need to be set up for success. But we see your work as critical to really all the work that we do on the ground. So we see, again, this meeting as an opportunity for USAID to hear from you within the technical sessions, sharing best practices amongst each other, listening sessions to hear your candid feedback. And we'll also be supporting a CEO session to engage with your leadership and ours to see, again, how we can support you in this work. So again, I cannot thank you enough. As you see in the data, we rely on you, our clients rely on you. And again, just want to thank you and your teams for all you've done, not just in PEPFAR, but really going above and beyond over the last year to ensure that we're serving our clients on the ground as best we can. So thank you so much. Really looking forward to the rest of the meeting this week. Kelly, back over to you.
Thank you so much, Clint. And I want to give another round of thanks to Jennifer and Anjali for sharing your remarks with us this morning. Before we go to our next panel, which will start at 8 a.m. Eastern Time and 2 p.m. Central African Time, I just wanted to draw everyone's attention to a few things on the agenda. First, the next panel is focused on COVID and human rights and political crisis. I know it is going to be super interesting and fantastic discussion about how we continue to push forward with our HIV/AIDS programs, even in the midst of ongoing crises. So please stay tuned for that upcoming panel. Following that panel today, we will have multiple country breakout sessions. These are called the listening sessions. This is a really important opportunity for local partners to share with USAID staff feedback on how we can work better together. So I absolutely encourage everyone to attend those sessions. You will see in the agenda on the Tech Change platform, you will see your country name. And so please go to the correct link for your country. We are asking all mission staff to attend, as well as local partners. We're asking local partners to respond to 2 questions. How can USAID work better with local partners? And the second question, recognizing that we don't do anything in isolation. How can USAID support local organizations as you work with broader stakeholders, local governments, other partners to improve our HIV/AIDS programs? I encourage local organizations, please share your candid feedback with USAID in those rooms. To draw your attention, those sessions will close at 11 a.m. Eastern Standard Time. We cannot extend the time in those rooms. So I'd ask moderators to please be very mindful of the time and try to get through all the organizations so we can share remarks. Lastly, I know we're getting close to time, and I want to make sure you are able to hear the next panel. I want to draw your attention tomorrow to our live Q&A with Administrator Power. That will start at 11:10 Eastern Standard Time. This will really be a one-of-a-kind opportunity to hear directly from the administrator and hear her respond to questions from some of our local organization representatives. So please don't miss that. As Clint mentioned, there is also a session tomorrow for local organization executives. That will be an opportunity for local organizations to directly ask USAID leadership from our Office of HIV/AIDS, our Office of Acquisition Assistance, our CFO office, any questions you may have on how you do your programs, priorities, your contracts. So please come tomorrow to that session. It is first thing in the morning for those of us here in Washington. And lastly, on Thursday, November 4th, we will have a closing plenary. It's titled The Future of Aid. It's going to be a fantastic discussion on sustainability for local organizations. So please don't miss that. I also want to draw your attention to the posters on the Tech Change platform. Poster is maybe a misnomer. We actually have several many organizations have submitted videos. I've watched some of them. They're super interesting. You can watch those videos and leave remarks, and I encourage you to please look at those. That is all from me. I think we are going for a quick break, and then we'll be over to our next panel. Thank you so much.